Hey guys, Dr. Greg here with Dr. Greg Functional Medicine. In this video, we're going to talk about one of my go-to detox protocols, and that is the good old coffee enema. Now, before you go, coffee doesn't go there, let's talk about why. So a coffee enema is really a liver detox tool, not necessarily a gut detox tool. Here's the physiology of it. You see, your liver and gallbladder sit on the right side of you below your rib cage. You then have this vein called your hepatobiliary vein that exits out really close to where the bowels come out. And when we put that vein in the presence of specifically brewed, specifically prepared coffee, according to research, your body increases something called glutathione S transferase by upwards of 600%. By the way, glutathione is the most potent antioxidant in the world. And to get an IV that can even match that much glutathione, you're spending upwards of $300 or $400. So let's walk through the process here from the very beginning. Now, in some cases, when you start, you may want to use just the coffee without any specific supplements. And what I would say for probably the first 2 or 3 times, do not use any of the supplements so that your body can just get used to what it looks like and how your body is going to respond. For the sake of this video, though, I'm going to walk through the full supercharged coffee enema version. So what we first want to do is we want to prepare your liver and your gallbladder to benefit the most from the coffee enema. Years ago, I would make my patients do these full-on liver gallbladder flushes, and they were horrible. I would actually make people, so for a week you wouldn't consume any fat, and then one night before you went to bed, you would actually have to drink a half a cup of olive oil before you went to bed with grapefruit juice. And I don't care who you are, that is the worst thing in the world. Now, thank goodness we can now do something that I believe is more powerful than the old grapefruit juice olive oil flushes. So about 30 minutes before you're gonna do your enema, we have what we call the 4-4-4 protocol. So there's 3 different products that we use that we take 4 capsules of. The first one is lymphatic support, because your lymphatic system has a huge contribution to the detoxification system. The second one is advanced TUDCA. So advanced TUDCA is an actual bile salt, and it asks your liver to purge whatever is inside of it. And the third one is KL support. K stands for kidney, L stands for liver. We take 4 of each of those products about 30 minutes before we administer the coffee enema. I also here have biotoxin binder. Biotoxin binder is actually taken at the end of the process, and it acts as the cleanup crew so that when your body releases these toxins, they aren't left into outer space. So biotoxin binder is taken after you get rid of your coffee enema. Now, to make the proper process, you obviously need some tools. So first off, you're going to need distilled or spring water. You're going to need something to make your water hot. This is just my tea kettle. You're going to need enema coffee. By the way, this is not anything that you would ever even dream about drinking. This is specifically brewed enema coffee, very light roast. One of the components of enema coffee is it's very high in caffeine. And I can tell you this, I have many patients that do not tolerate caffeine, and they do not have an adverse reaction to the caffeine in a coffee enema. You'll need something to hold the coffee and the bean in. I just think a French press is the simplest way to do that. And then you're gonna need an enema kit, and we provide you with all of the links for all of these components. So the first thing that we do is I like to use 1 tablespoon of bean for every cup of water. So I have 4 cups of boiled water in my tea kettle. So I'm going to take 4 tablespoons of the coffee and put it in my French press. After we've done that, take your hot water and pour it so that all of the bean gets saturated. And again, this will not look like normal coffee. This stuff is like a light tan color, so don't be surprised if this doesn't look like your morning cup of coffee. And then we need to let the water draw the chemicals out of the coffee. So what I'll do is I'll put the top on my French press without plunging it, and I let it set in here for at least 10 minutes. After 10 minutes, you can now press the water out. The next step is making sure that the water is the right temperature. So from here, we're going to transition over to the bathroom, and now I'm going to talk about how to use the Enema kit and how to use the tools to make that work. Before I get there, I do want to talk about the supercharged version. So we will use 10 drops of both CT minerals and 10 drops of hydroxygen in the actual coffee solution. And we do that because when these particular products are in your distal colon, their absorption rate goes through the roof. So when you get to the advanced version, which would be like your 4th or 5th moving on enema, we want to put those products actually right into your Enema kit. All right, so the coffee is getting brewed, so next step is we'll meet you in the bathroom and we'll get ready to do the administration. All right, guys, Dr. Greg, and now we're ready for the second step with the coffee enema. So we're in the bathroom and we're ready to actually do the administration. If it's your first time doing a coffee enema, what I recommend that people do is find like a bathtub or a large shower that you can do this in. No one's ever really made a mess with this, but if you would feel more comfortable the first time, absolutely go for it. The second thing is it's going to be we're going to use a smaller amount of liquid the first time. Actually, the first couple of times, we're going to use only about 2 cups of the Enema solution. And then you'll actually graduate up to about 4 cups of the solution. There's also better times to do coffee enemas. In my opinion, the best time to do a coffee enema is after you've had a bowel movement. And why that is if your body needs to have a bowel movement and you're trying to put coffee up there, it's competing for space, so it's just not going to go as well. The other thing that I really want you to understand is this is not about how long you kept it in. Some people just seem to be able to hold coffee enemas longer than others. It's not a race. The goal is we want ideally 5 to 10 minutes, but here's the scoop. If you put it in and a couple minutes later it's time to come out, obey your body. Listen to your body. You do you when it comes to coffee enemas. Okay, first step is we're going to take our coffee from our French press and we're going to put it into a container. And why I do this is because the temperature of the coffee is super important. Having coffee that's too hot or too cold will absolutely make this a miserable experiment. So we're going to pour 2 cups in here. Now, the color of the coffee is not what you're used to when you see coffee. Again, this is a ultra light roast, which has the highest amount of caffeine and chemicals that work for coffee enemas. Now, how you know whether or not it's body temperature is simply by sticking your finger into the liquid, and if it doesn't feel either warm or cold, it's body temperature. So this is a perfect temperature. The next thing that we're going to do is we're going to make sure that we have the right tip put on our enema. So when this kit comes from the delivery, it'll be all separate. So you put the long silicone tube on. Make sure that this white piece is towards the end of the tube. This stops the flow of the liquid through the tube, and this is what we call a stopcock. So before you put any water in there, make sure that you pinch this all the way down. And here's why. If you pour coffee into that tub without closing this, the coffee is going to flow right through and you are going to have a mess on your hands. So go ahead and actually, before you do that, what I want you to do then is we're going to use a little bit of lubrication. So this has no sharp edges. It's very smooth, though this may be uncomfortable the first couple times, so I want just to use some aid. So I use coconut oil, and there's 2 places that I put the coconut oil. The first place is I take maybe about a pea size, and I put it right on my butt. right on the spot where it's going to go in. And then the second amount, I take the coconut oil and I generously put it around the tip of the actual insertion tube itself, so that there's adequate lubrication and there's no irritation when you insert the tube. All right, now we're ready to pour the coffee in. And if you're ready for the supercharged version, you're also going to put the hydroxygen, 10 drops, and the CT minerals, 10 drops into the actual coffee solution. Okay, so we are ready to go. A couple tips and tricks about getting the most of this. So the first thing is you're going to be laying down with your right side down. So your right side is going to be down, your left side is going to be up. I put a towel down on my bathroom floor, and I will typically have my kit on my kitchen sink. So I leave this on the level of the counter of not the kitchen sink, but the bathroom sink. And then what I will do is I actually put the tube up when I'm standing up. So as I'm standing, the tip is lubed and my butt is lubed, and I will actually reach around myself and I'll squat a little bit and I will find the spot and I will insert this as far up the tube as I can. You're not going to go any further past the tip of the tube. So now one hand is holding this into my backside, and the other hand is going to make sure that I don't pull the kit off of the countertop. So I nice and easily go down to my knees, and then I easily just lay onto my right side. Once I'm laying onto my right side and I'm in a nice relaxed position, I have my knees bent so that my stomach is relaxed. And then what I do is then you'll reach around and you will open up, or you'll push forward this device. And what it does is it opens up the flow of the tube. And then the coffee will start to flow into your colon. And what you may feel is like a little bit of a full sensation, or you might feel like, I got things coming into me. It's exactly perfectly normal. If it gets to the point where you're like, this hurts and I don't like this, just reach back, pinch the stopcock so it pinches it off, and then you can easily, slowly pull the device out of your bum, and then you can just lay there for a bit. Because the exit of the coffee is a little bit up on the actual device itself, when I'm laying down on my right side, I will actually grab onto this and I will tip it at an angle of about this, so all of the coffee actually comes out of the tip instead of there being a ½ inch or so in the bottom of it. If you do that and you start to see the end of the coffee come down the tube, there's no reason to put any air up there. So before that coffee gets to the end of the tube, make sure that you pinch off the tubing. And so what I do, because I've done this for about 15 years, is I pull this out and I immediately take this thing and I put it back into the tub so it's ready to be cleaned. If you're first at this, you may just want to just lay on your right side, take some good cleansing breaths. Here's the reality. When it is time, when your body says it's time for the coffee to come out, obey. Don't try to, suck it up for another 30 seconds or so. You will know when it's time to get rid of it. And when it's time to get rid of it, just simply get up and sit on the toilet and do just like you'd have a bowel movement. It's going to be very watery, and the vast majority of it will come out the very first time. The nice thing about coffee enemas is that you're not going to be on the toilet 47 more times over the next 2 hours. You may have another small void in the next 20 to 30 minutes, and you're done. What I do from there then is I make sure that I clean my kit up really well. So I start by rinsing it with very hot water, not just the kit itself, but I take the tip off, I run hot water through the tubing. Some people will even do things like dishwasher, completely up to you. We just want to make sure that after it's been washed out, it gets dried thoroughly. The last thing that we want is any mold inside of our coffee kit. Everyone feels a little bit different after a coffee enema. Personally, I feel energized. I feel focused. I feel like I have more energy for the day. What I can tell you is I've had probably close to 1,000 patients now do coffee enemas, and I have yet to have a patient say to me like, Dr. Greg, do you not like me? Like, that was horrible. Every single person that's done coffee enemas has found a benefit for them. So my hope and prayer is that you can find this as a part of your regime. The frequency of these will depend upon what you have going on. I was formerly trained in a cancer therapy where you did these every single day. The typical rhythm that I like my patients to use coffee enemas is like 1 to 3 or 4 times a week, depending upon how you're feeling. The ultimate goal is we want this to be part of your consistent program, and I also want this to be a tool in your toolbox when you know that you need it. So if there's any questions, definitely let us know. Obviously, you need some of the right tools to do this, and there you have it. There's the coffee enema. Enjoy.